Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about sports amenorrhea. Amenorrhea is basically the absence or cessation of menstrual flow. It is the clinical symptom which indicates the disruption of reproductive system with probable and ovulation. So it is of two types, primary and secondary. Primary amenorrhea is the absence of menarche by the age of 16, and secondary is the absence of 3 to 12 consecutive menstrual periods after normal menarche has occurred. So basically the sports amenorrhea, which is the most frequent cause of amenorrhea in athletes, its incidence is higher in runners, in ballet dancers and sports emphasizing leanness. So causes, it is associated with disruption of hypothalamic pituitary ovarian axis and neuroendocrine abnormalities including low level of thyroid hormones, insulin like growth factor 1, and increased level of the cortisol. So the etiology appeared to be related to energy drain, that is the phenomena of a calorie deficit. So with the help of this figure, one can easily understand the cause, like the area red. These are the three related components of female athlete diet, like eating too little, and in turn calorie availability and menstrual status influence the bone health. Also, like we can say that low energy availability with or without an eating disorder, functional hypothalamic amenorrhea and osteoporosis. So these are the disorders, and also which further lead to low bone mineral density. And the area which is green, that is the optimal health in female, which is indicated by adequate energy availability, regular periods and good bone health. So low energy availability is a common cause which can arise from eating disorder or disordered eating, and inadvertent mismatch between calorie intake and exercise energy expenditure. Because of the decreased in calorie intake, also increased exercise energy expenditure lead to low energy availability or energy deficiency, which can alter the hormones like cortisol, leptin, or gonadotropin releasing hormone, LH, excess estrogen, progesterone, so many other factors, and also which further lead to hypothalamic amenorrhea. And also low energy availability decrease the resting metabolic rate. And further, if there are psychological indicators like eating disorder, increased drive for thinness, increased cognitive dietary strain, increased eating weight and shape concern, so that can also lead to hypothalamic amenorrhea. So high energy expenditure plus low energy intake lead to physiological adaptation to conserve the fluid. So reproductive abnormalities like decreased estrogen occur in the female body, and metabolic abnormalities like decreased leptin, decreased T3, insulin like growth factor 1, decreased insulin also, increased bone resorption, and also decrease the bone formation. So there is uncoupling of bone turnover which leads to bone loss. So other causes like low body fat, like the female body cannot menstruate below a certain level of body fat percentage, and exercise related hormones, like exercise makes the body release certain hormones like beta endorphin, catecholamines, and high levels affect estrogen and progesterone work. Psychological stress like strong negative emotions also affect the hypothalamus function. Level of exercise, which is also related to menstrual disturbance via contribution energy imbalance or immature reproductive system. So symptoms are no periods for at least 3 months, irregular heavy periods which happen only 4 times or less each year. Amenorrheic athletes have low bone mineral density. Features of hypoestrogenic state include atrophic vaginitis or hot flushes. So this is the diagnosis. It's very important to take history and do examination, which further lead to some finding, and we reach the provisional diagnosis as shown in this chart. Complications and risk: it reduces the fertility, high level of cholesterol, and loss of bone density like osteopenia or osteoporosis. So it further increase the risk of stress fractures in the body. So treatment, so when a woman presents with amenorrhea, the physician should take a history, including the dietary intake, complete a focused physical examination, and investigate the serum hormonal profile. So our aim is to normalize the nutritional intake, better balance of training, and exercise intensity and recovery strategy. So improving the energy availability is the cornerstone of the treatment, and also involve an interdisciplinary team. If bone mineral density is low or decreasing over time, particularly in adolescence, so adjunct treatment with transdermal 17 beta estradiol and cyclic orforglipron can be considered. So this is the interdisciplinary treatment team like physician, dietitian, and professional mental health professional, parents or coach. Reasonable trial of lifestyle modification like improve calorie intake, family based or cognitive behavioral therapy, or dialectic behavioral therapy, hormonal therapy one can take. Thank you.